presentation for my communications class, 2:30. The presentation is going to be, since I'm a nurse, it's going to be on decrease in hospital readmission rates in patients with heart failure and the role of the nurse. I'm going to start out by talking about a little bit about what is heart failure. According to the American Heart Association, heart failure is a chronic progressive condition in which the heart muscles is unable to pump enough blood through the heart to meet the body's need for blood and oxygen. So I'm going to talk a little bit about signs and symptoms of heart failure. So some of the symptoms of heart failure are shortness of breath during activity and at rest, persistent coughing or wheezing, a buildup of fluid, or also called edema, in the feet, ankles, legs, or abdomen, tiredness, fatigue with activities, decreased appetite, and in the late stages of heart failure, some people become confused or have memory loss. Also, I just want to discuss how do clinicians treat heart failure. Lifestyle state changes such as quitting smoking, managing stress, losing weight is important to treat heart failure. Daily exercise as well as getting adequate rest. Eating a low-fat, low-sodium diet. Tracking daily weight, avoiding alcohol, and limiting your fluid intake to 1,500 mLs or 1.5 liters a day. Patients can benefit from joining a support group. There's medications to treat heart failure. And the only cure for heart failure is heart transplantation. There's no cure for heart failure. Just going to discuss some facts about heart failure and how it affects patients with heart failure. Congestive heart failure is a very complex, chronic, debilitating illness that affects approximately 5.3 million Americans. Heart failure accounts for a total of 1.1 million hospitalizations a year, so you see it really does impact our healthcare industry. Treating heart failure results in nearly $3.4 billion in annual healthcare costs. It costs a lot to treat heart failure patients. Every year, 550,000 new patients are diagnosed with heart failure. So you can see every year we have new patients to treat. This is a big fact here, and this is why we need to cut the readmission rates of heart failure. Patients' non-compliance and following a low-sodium diet, maintaining fluid restriction, monitoring their daily weights, and not following their medication regime often lead to many heart failure patients being readmitted to the hospital. 27% of all patients are readmitted within 30 days of leaving the hospital. And that's a large number. We need to cut that down. Heart failure patients' readmissions cost Medicare $18 billion per year and are the most frequent reasons for rehospitalization. Why do nurses play an important role in reducing readmission rates in heart failure patients? Now more than ever, the role of nursing will play a vital role in reducing complications and readmission rates of patients with heart failure. According to the Center for Medicare and Medicaid Services, they've identified readmission rates for patients with heart failure be measured in hospitals with the highest readmission rates will have reduced reimbursements of 1% this year, 2% in 2014, and then ultimately capped at 3% in 2015. So you can see it's really important for hospitals and clinicians to decrease heart failure rates. Savings with preventing hospital readmission rates of heart failure patients receiving Medicare is projected to be $7.1 billion over 10 years. Hospitals recognizing the need to decrease heart failure readmission rates will develop a heart failure disease management programs. Development of a nurse heart failure transition coordinator role to assist patients transition from the acute care setting to the home care setting. A heart failure nurse will identify all heart failure patients admitted to the hospital. Heart failure nurse will meet with each patient during their admission to discuss the program and its goals, taking a multidisciplinary approach. assessing their lifestyle, and taking it, discussing and understanding the patient's the heart failure process. The heart failure nurse will educate heart failure patients immediately on the importance of a low sodium diet, maintaining a fluid restriction, daily weights, and the signs and symptoms of worsening heart failure. Anybody in the group have any questions?
I do.
Sure.
I was, the part that talked about
Mm-hmm.
the caps. So
Right.
does that mean the hospitals are gonna be losing money because
Yes.
they're gonna put a cap on it? So it would be in your best interest to make sure that patients are not readmitted,
Exactly.
correct?
Under
my
the new
goodness.
healthcare law in 2010,
Uh-huh.
also known as Obamacare. That's what President Obama wanted to put in there because hospitals were inefficient in caring for heart failure patients.
Okay, that was my next
As you can
question.
see, a quarter of the patients were coming back within 30 days.
Yeah.
So what we need to do is look at better ways to treat these patients, and one of the ways is having a nurse follow these patients while they're in the hospital and follow them while they're at
So
home.
sort of like retention, like when once they get home, to stay in touch and make sure they're taking their meds and they're
Exactly.
continuing with their low sodium diet and
Right.
things like that.
Exactly.
Okay, so
Yeah,
the
and
hospitals are gonna be losing money if these patients continue to return every 30 days,
You're talking
right?
billions of dollars.
Oh my goodness.
Billions of
Oh my
dollars, and it's an
goodness.
incentive for them
Okay.
to develop programs like this, and that's where the role of nurses come in.
Yeah, so
So-
and nobody wants to lose money
No,
because the
you're
staff
right.
has to be paid, you know?
Exactly, yep.
Wow.
Any more questions? Once the patients are discharged from the hospital, the heart failure nurse plays an important role by following up with patients by phone consultation and arranging and visiting heart failure home care nursing, post-discharge follow-up, and that's what we were just discussing.
Mm-hmm.
The heart failure nurse will also make and confirm any appointments the patient may have upon discharge, continuing to educate the patient post-admission is imperative to reinforcing the heart failure process, and that's what we were kind of just talking about, is having those patients educated on what they need to do. And then finally, in clinical trials sponsored by the National Institutes of Health, heart failure readmission rates within 6 weeks was reduced by 57%.
Wow.
So that's pretty significant. I mean,
Yeah.
we decreased
That's
that almost over half. Within 6 months, it was reduced 50% using a heart failure nurse. So you can see the role of the nurse is very vital to decreasing the readmission rates.
So there would just be nurses specifically that work with heart failure
Yes.
patients? Okay.
Yes, and in the institution that I work at, that's what we've done.
Because I come from the social services world,
Mhm.
and in our world, we do follow up with clients even after they left the program for 6 months, up to a year.
Right.
And it's like case management work. It's a
same.
lot of work, but
It's the same process. In the past, we just discharged these patients to home, and there was no follow-up.
okay.
And now, because of the new law, you know, in the ACA 2010 law, this is forcing hospitals to follow through with their patients.
Okay.
And it's proven to work.
That's
6 and
nice.
12-month costs associated with readmission rates were reduced by 58% and 39% respectively when
Wow.
using a heart failure nurse. So we're talking billions of dollars
Yes.
saved.
A lot of money.
Heart failure is a complex and difficult disease for patients to manage on their own. And through education and close monitoring, heart failure patients, through monitoring, heart failure patients the heart failure nurse plays an important role in improving the quality of life and reducing readmission rates of heart failure patients, which will ultimately reduce healthcare costs. At all levels of care, nurses will drive public policy, disease prevention, and healthcare promotion. Finally, the nurse's role as caregiver continues to evolve to include the role of nurse navigator, disease manager, and educator. Any questions?
Definitely educator. You have to
Thank
educate the people about the illnesses.
Yes. All right, thank you guys. Thank you.
Oh, great.